1 in 10 babies are born prematurely. My son Emmanuel was one of those babies. Although 15 million babies are born prematurely every year, 95% of babies between 28 and 37 weeks go on to live mostly normal lives. Many people do not think that these statistics or information will apply to their lives, but the truth is, if 1 in 10 babies are born prematurely, one of you here today could find yourself in a situation where you must prepare yourself for preterm birth. A few things I want to talk about are who is at risk for premature birth, the chances of live birth between 26 and 37 weeks, and the steps to help prevent preterm labor. Those at risk of having a premature baby are smokers, women pregnant with multiples, diabetes, and extreme stress. When I was pregnant with Emmanuel at age 20, I was a smoker, had prediabetes, and was under extreme stress because I did not have the support of his biological father. I was told my chances were higher because of the 3 factors mentioned before. Women with multiples are at higher risk by almost 100%. This leads me into the percentage of premature babies that go on to live normal lives. 80% of babies born at 26 weeks live to at least 1 year old. 90% of babies born at 27 weeks also live to at least 1 year old. Although such a high percentage of these children live, many of them are not without mild or severe medical conditions or extended stays in the neonatal intensive unit. Babies born between 28 and 31 weeks have an even higher survival rate, about 96%. These babies are not at such high risk for disabilities. 98% of babies born after 32 weeks live and have a very low rate of complications and disabilities. This leads me into the signs and symptoms of preterm labor and what you can do to help prevent and recognize the signs for yourself or a loved one. A few signs of preterm labor are regular and frequent contractions, low backaches, abdominal pressure, cramping, bleeding, and discharge. If you or a loved one have any of these signs, you would most likely be advised to call your healthcare provider or head to an emergency room. Some ways you can help prevent preterm labor is by quitting smoking, not using illicit drugs, and trying to reduce your overall life stress. You can also seek the correct prenatal care for you and your unborn baby. If someone you love is at risk for going into preterm labor, giving them all the love and support that you possibly can will help improve their chances of delivering their baby full term. In closing, I challenge you to look at the information that you have learned today. If you are close to someone who is pregnant and has the few signs of being at risk for preterm labor, I encourage you to speak up and to be supportive of these precious women in your lives. If you are one of the women I mentioned or find yourself in a situation that could put you in preterm labor, do not be afraid to speak out and ask for help. Too many women today do not have the support system they need. I hope I have educated you on the topic of premature birth and that you will do what you can to help the future children of this world. Thank you.